If you're experiencing symptoms of too much stomach acid like stomach upset, heartburn, or acid indigestion, this medication can help. It can also relieve symptoms of extra gas such as belching, bloating, and feelings of pressure or discomfort in the stomach. This medication contains simethicone, which helps break up gas bubbles in the gut, as well as aluminum and magnesium antacids, which work quickly to lower the acid in the stomach. It's important to note that this medication only works on existing acid in the stomach and does not prevent acid production. You can take it alone or with other medications that lower acid production, such as H2 blockers or proton pump inhibitors. If you're considering self-treating with this medication, be sure to carefully read the package instructions to ensure it's the right product for you. Some products may have similar brand names but different active ingredients and uses, so it's important to ask your pharmacist if you have any questions about your product or its use. When taking Antacid regular strength 200 mg, 200 mg, 20 mg/5 ml oral suspension, it's best to take it after meals and at bedtime as needed. Be sure to carefully follow the directions on the product package or as directed by your doctor. If you have any questions, don't hesitate to ask your doctor or pharmacist. If you're using the chewable tablets, make sure to chew thoroughly before swallowing, then drink a full glass of water. For the liquid form, be sure to shake the bottle well before pouring each dose. It's important to measure the dose carefully using a medication spoon/cup. Don't use a household spoon because you may not get the right dose. You can refrigerate the suspension to improve the flavor, but do not freeze it. The liquid form works best if taken without other fluids, but you can mix your dose with a little water if needed. It's important to note that this product may react with other medications, preventing them from being fully absorbed by your body. Be sure to talk with your doctor or pharmacist about how to schedule your medications to prevent this problem. If your acid problems persist or worsen after using this product for 1 week, or if you think you have a serious medical problem, seek medical help right away. If you are using this medication regularly on a daily basis for more than 2 weeks, it's important to ask your doctor whether this is the right medication for you. Some possible side effects may include nausea, constipation, diarrhea, or headache. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist as soon as possible. The magnesium in this product can lead to diarrhea, but using an antacid that contains only aluminum along with this product can help control diarrhea. On the other hand, the aluminum in this product can cause constipation. To minimize constipation, it's recommended to drink plenty of fluids and exercise. Diarrhea is more common with this product than constipation. If your doctor has prescribed this medication, it's because they have determined that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. Antacids containing aluminum bind to phosphate in the gut, which can lead to low phosphate levels, especially if this medication is used in large doses and for a long time. It's important to notify your doctor right away if you experience symptoms of low phosphate, such as loss of appetite, unusual tiredness, or muscle weakness. Serious side effects that require immediate medical attention include dizziness, fainting, slow/shallow breathing, slow/irregular heartbeat, mental/mood changes, such as confusion, deep sleep, and pain with urination. While a serious allergic reaction to this drug is rare, it's crucial to seek medical help right away if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or difficulty breathing. This is not an exhaustive list of potential side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed. In the US, if you notice any side effects, it's important to call your doctor for medical advice. You may also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, if you experience any side effects, it's important to call your doctor for medical advice. You may also report side effects to Health Canada at 1-866-234-2345. Before using this antacid oral suspension, it's important to talk to your doctor or pharmacist if you have any allergies to aluminum hydroxide, magnesium, or simethicone, as this product may contain inactive ingredients that can cause allergic reactions. If you have health conditions such as frequent alcohol use, dehydration, kidney problems, or phenylketonuria, PKU, it's essential to consult your healthcare provider before using this medication. Additionally, if you have diabetes or are pregnant or breastfeeding, it's important to discuss the use of this medication with your doctor to ensure safety and effectiveness. Always follow the recommended dosage and consult with your healthcare provider for the best timing to take this medication. It's important to be aware that antacids like this one can interact with other medications you may be taking. Always keep a list of all the products you use and share it with your doctor and pharmacist to avoid any potential drug interactions. Some products that may interact with this antacid are phosphate supplements like potassium phosphate and sodium polystyrene sulfonate. Also, antacids can interfere with the absorption of many other drugs, so it's essential to check with your pharmacist before taking antacids with any other medication. Remember, never start, stop, or change the dosage of any medicines without your doctor's approval. If you suspect an overdose and the person is experiencing severe symptoms like fainting or difficulty breathing, seek immediate medical attention by calling 911. Otherwise, contact your local poison control center for assistance. If you live in the US, you can call 1-800-222-1222, and if you reside in Canada, contact your provincial poison control center. Make sure to attend all your medical and lab appointments. It's also important to make some lifestyle changes to get the most out of this medication. Consider stress reduction programs, quitting smoking, limiting alcohol intake, and making changes to your diet, like avoiding caffeine, fatty foods, and certain spices. You can talk to your doctor or pharmacist for more advice on lifestyle changes that could help you. It's important to take this medication as directed and follow the recommended dosage. And for the best results, take it at the optimal timing recommended by your healthcare provider. If you are using this antacid regularly and you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. When it comes to storing antacid regular strength 200 mg, 200 mg, 20 mg/5 ml oral suspension, make sure to keep it at room temperature away from light and moisture. If you have the liquid form, you can store it in the refrigerator to improve the taste, but do not freeze it. It's important to keep all medications out of reach of children and pets, so make sure to store it in a safe place. When it comes to getting rid of this medication, don't flush it down the toilet or pour it into a drain unless you're instructed to do so. Instead, properly discard the product when it's expired or no longer needed. If you're unsure about how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.